Dr. Oz, thank you for being here today. And now that you've experienced the Pain Expo, you've met some of the participants here, some of the attendees here, and you've also presented, please give us your perspective on the Pain Expo and what you're thinking about it now. And maybe what you first thought about it and now what you're thinking about it now since you've been here.
When I first heard about the Pain Expo, since there had not been one before, it was a leap of faith for me as well. But I really liked the idea of a program that was organized by patients for patients in the area of pain. And the reason for that is, as a heart surgeon, I care whether people have chest pain or not, but I care even more often about the tests that I can do to show whether their life is at risk or not. But in pain, it's very different. I don't have a test that shows me how much pain you're having. I have tests I can do that shows me why you might have pain. They might explain which silo or category to put you in. But I really can't compare pain levels, and I can't really customize my care to you without you being involved. So the idea that we take the focus, the locus of control, away from the doctor and put it in the lap of the patient where it belongs, I think was a wonderful idea. The other thing is I go all over the country talking to groups about different topics. When pain questions come up, all bets are off. Because the pain patients are some of the most educated people I know of, because they have to be. Their whole life is focused on the symptoms that they're suffering from, and they have to become the world expert in their body, so they end up teaching me. Remember, the word doctor means teacher, right? So you can have a lot of teachers in the room, and if you've got smart pupils, they'll eventually know more than the teachers do, and they teach the teachers. So to have an organization that's built around the people who are suffering the problems and allow them to create a community where they exchange best ideas, best practices, to educate each other about how to get the most out of the healthcare system and how to use the different therapies that are out there, including the alternative therapies, is hugely valuable. And I must say, the other part about a meeting like this that's the risk is that it becomes a bunch of fringe elements coming together where there's no real semblance of reality. And that's not what's happened here. You've got smart people, everyone's well-meaning, so I'm not going to put motivation into the issue. But these are sharp people who've done their homework, who understand the issues, who have brought the doctors that they feel provide them the best care together to provide the basic foundation of education, which you got to have. But you go past that, and you begin to exchange ideas that work for you. Oh yeah, I was taking that medication, but I talked to my doctor and it seemed to make sense to both of us that we do this. And frankly, the doctor may not have thought about it. And all of a sudden you're off the medications, or you've tried a new therapy, or you've taken the risk and had the surgery, or you didn't have the surgery because you heard from colleagues it didn't work that well. You want that kind of dialogue. That's where true education happens. Not when I tell you something, but when you tell someone who loves you and trusts you something because you truly deep down inside believe it to be true. And that's what we're finding at Pain Expo.